My name is Michelle Griffin, and my final project is titled A Mixed Method Study: Gender Differences in Experiences of Stigma Associated with Alcohol-Related Injuries in Tanzania. Presentation outline: Introduction, objectives, methods, results, discussion, and then references. Each year, excessive alcohol use accounts for roughly 3.3 million deaths globally. According to the World Health Organization, excessive alcohol use accounts for 5.1% of the global burden of disease and is the leading cause of avoidable death and disability in sub-Saharan Africa. Recent data suggests that 30% of all injuries presenting to the emergency department in Tanzania are caused by alcohol use. There are three different categories of stigma related to alcohol use. There's perceived stigma, which is defined as developing negative feelings because of known prejudices society places on alcohol use. Experienced or felt stigma, which is defined as being exposed to discrimination or being devalued. And lastly, self-stigma. Self-stigma is defined as seeing yourself as damaged. These definitions come from the modified labeling theory, which is the framework most commonly used to describe alcohol use-related stigma. The objectives of my project are as follows. Analyze the differences of alcohol-related stigma between men and women, and identify differences between alcohol-related injuries in men and women. Data for this project were used from the Developing a Brief Intervention for Alcohol in Tanzania. This was a K award from the National Institutes of Health awarded to Dr. Catherine Staton. The study took place at Kilimanjaro Christian Medical Center in Moshi, Tanzania between 2016 and 2018. All participants signed an informed consent prior to participating. Instruments utilized for analysis were the Perceived Alcohol Stigma Scale, or the PASS. This scale is a Likert type scale and scores along two constructs. The first is perceived discrimination, and the second is perceived devaluation. Question: This scale is commonly used along with the modified labeling theory. The other scale is the Alcohol Use Disorder Identification Test, or AUDIT. The audit was developed by the WHO to identify the likelihood of problematic drinking. A score of 0 to 1 indicates abstainers from drinking. Then there's low risk, risky, harmful, severe. So the higher the audit, the more likely someone is for problematic drinking. Both scales are translated and then back translated to Swahili by a trained bilingual research assistant. Then a trained bilingual research nurse administered the scales verbally to each participant in a private room near the emergency department at Kilimanjaro Christian Medical Center. Focus groups were coded using a thematic approach. There were 3 independent coders utilized for this project, 2 additional graduate students and 1 Tanzanian, so that cultural awareness was applied to coding themes. Linear regression was used to examine stigma differences between men and women, and it was also used to examine whether or not alcohol consumed 6 hours prior to injury was a predictor of the injury in both men and women. In this first table, the majority of participants are men, and the majority of participants are ages 26 to 35 years of age. There are no socio-demographic characteristics captured as part of the original study due to reliability in reporting. Results are broken down by gender. And by the 2 constructs of the PASS. There were no significant findings for the perceived discrimination construct, so there's no slide for that. For the men here, for perceived evaluation in men, this was statistically predicted by age. The p-value, you can see the p-value of 0.004. Also, this indicates that for every 10 years of age, the perceived evaluation score will increase in men. Women, there was no statistical significance noted. As for injury, the total audit score was a predictor for alcohol use prior to six hours prior to injury here in men. You can see the p-value is 0.004. There was no statistical significance in women. For the focus group data, there were 3 themes that emerged: negative perceptions associated with the amount of alcohol used, negative perceptions of disclosure of alcohol use by healthcare providers, and gender-related stigma towards alcohol use. There were 2 stigma sub-themes that emerged, and they also align with the perceived alcohol stigma scale: enacted stigma discrimination and experienced stigma devaluation. This is the first study in this region to assess gender differences in alcohol-related stigma. The study found that as men age, their perceived devaluation score increases. The focus group data indicates that stigma associated with alcohol use and injury may be a barrier for patients seeking health care when injured while intoxicated. There were some limitations in the study. There was only 1 woman that tested positive for alcohol on arrival. It is highly possible that only patients with transportation to the hospital after injury were enrolled. It's also highly likely that heavily intoxicated patients did not present for treatment until a later time and were not enrolled in the study. Lastly, there is also likely a reporting bias in relation to stigma. Since stigma is being discriminated against, participants may not have wanted to report accurately during focus groups and on the various scales. This is also more likely true for women than in men. Thank you.